The human arm is a crucial anatomical region composed of muscles responsible for elbow and shoulder movement. These muscles are divided into two compartments. The anterior compartment, also called the flexor compartment, which primarily facilitates arm flexion, and the posterior or extensor compartment, which enables extension. The anterior compartment contains the biceps brachii, the brachialis, and the coracobrachialis, while the posterior compartment consists of the triceps brachii. The biceps brachii has two heads, the long head and the short head. The long head originates from the supraglenoid tubercle of the scapula, while the short head originates from the coracoid process of the scapula. The biceps brachii inserts into the radial tuberosity and bicipital aponeurosis in the forearm. The biceps is the primary supinator of the forearm and flexor of the elbow. It also assists in shoulder flexion due to its attachment to the scapula. The brachialis lies deep to the biceps brachii and is the primary flexor of the elbow. It originates from the distal half of the anterior surface of the humerus and inserts into the coronoid process and tuberosity of the ulna. It is the primary flexor of the elbow. The coracobrachialis is a small but important muscle aiding shoulder movement. It originates from the coracoid process of the scapula together with the short head of the biceps and inserts into the medial surface of the humerus at the midshaft level. It functions in flexion and adduction of the arm at the shoulder joint. The biceps brachii, the brachialis, and the coracobrachialis are all innervated by the musculocutaneous nerve. The triceps brachii is the only muscle in the posterior compartment and functions as the primary elbow extensor. It has three heads, the long, lateral, and medial heads. The long head originates from the infraglenoid tubercle of the scapula. The lateral head originates from the posterior surface of the humerus superior to the radial groove, while the medial head originates from the posterior surface of the humerus inferior to the radial groove. It inserts into the olecranon process of the ulna, and its main function is to extend the elbow. Also, the long head assists in shoulder extension and adduction. It is innervated by the radial nerve. The muscles of the arm are essential for precise and powerful movement, whether you are studying for exams, performing clinical evaluation, or working in rehabilitation. A solid grasp of the arm anatomy will enhance your medical expertise. Stay tuned for more in-depth anatomy tutorials.